Just hey. You're hey.
Hey, it's Dr. Lindsey and Wendy. In this short video, we're going to go through what to expect leading up to a hair transplant with us. To start with, hopefully you've already come in and seen me once or twice, and sometimes even 3 or 4 times, and you've brought a family member. If you're young, you've brought a parent to help keep you from making silly decisions, and that you've educated yourself on what your options are, and you're ready to go. Now, 10 days before, we want you to start following a pretty strict puritanical diet, meaning nothing that's going to thin your blood, such as alcohol, Advil, aspirin, shampoos that increase hair growth, Rogaine, oral minoxidil, and Indian or spicy food. All those things can make you bleed more during surgery, and that pushes your hair out and makes our surgery much harder to do. And green tea, that's the devil that makes you live longer, but really adversely impacts surgery. Don't you think, Wendy?
Yes, it makes you swell up. It makes it for an easier recovery if you follow those instructions.
Okay, so that's 10 days before, and we'll give you a sheet when you come for your pre-op, and if you lose that, it's on our website.
And you can see it in the video,
and it's also on this video. So that's 10 days before. The other thing that a lot of these younger and my age guys that are still trying to hold on to their youth take are these energy drinks that you buy at gyms that give you all kinds of vitamins and power and let you build muscle. No, not 10 days before. Most of those things have stuff in them, whether it's vitamin E or green tea or cumin, that will thin your blood. So you just got to lay off all that stuff. And then you should have your prescriptions by this point. We typically e-prescribe them the day of your pre-op, so pick them up and bring them with you, but don't take anything until after we have a discussion and take pictures the morning of the surgery. One day before the surgery, go through your checklist to have your medicines available, have your outfit available, meaning you're going to have a shirt that you will button up to wear home from our procedure. Have a t-shirt on that you don't care about, which will get messy and we'll cut off and throw in the trash can. And don't toast your procedure with a nice gin and tonic. No drinking until after you're not taking pain medicines. The morning of the surgery, you get up nice and early. You can have a little bit of breakfast and wash your head with whatever shampoo you normally use, as long as it doesn't have hair growth ingredients in it. And come to our office and be here on time at 7 a.m. Once you arrive at the office, we'll take your pictures, and I'll draw the plan that I think we've agreed on, and then you'll check it with a mirror or 2 mirrors and your family member, and then we'll take a picture of that, and at that point, the procedure starts. We'll give you a Valium that you'll bring with you, and at that point, you can't change your mind after that, because sometimes people get kind of buzzed on that Valium and come up with crazy ideas. So you don't take anything until we draw and prove the plan.
You'll have plenty of time to ask questions. He won't start until you are 100% ready to get started.
And we're here early. Usually you can come as early as 6:30 if you really want to get started. What about rides, Wendy? People can drive here, or they can take an Uber, or they can have a family member drop them off. But they shouldn't drive home because they will be under the influence of Valium, maybe a pain pill. What do you suggest?
Well, you can always leave your car here, and if you have somebody to drive you home, we'll give you half an hour heads up before we're done to call in your ride or call in over.
So that pretty much summarizes what we want you to do the 10 days before the procedure. If you have questions, give us a call during normal hours, and it should be a pretty laid back day. We've got 400 videos that go through what happens during the day. And so you shouldn't be too nervous. I can understand being anxious, but don't be too nervous. If you're that nervous, then you should come in and see us again before the day of the surgery, and we'll go through it again. It's no big deal. Thank you for your attention.